In today's news, over 800 BVI residents vaccinated against COVID-19 in weekend drive-through.
We also record 3 additional deaths. This is, of course, according to the Ministry of Health in the BVI. And the ministry is saying, that most of the COVID deaths in the BVI had underlying conditions.
BVI residents to access Pfizer and Moderna vaccine soon in the U.S. Virgin Islands, says Honorable Khadeen Malone.
And the Soca Star BDJ arrested in the U.S. Virgin Islands for allegedly assaulting a minor several times. All that and so much more on today's edition of 284 News.
The wait is over. CCT Fire is here. Experience ultra-fast downloads, seamless streaming, and even more reliable connectivity on an all-new fire-blazing super-fast CCT Fiber network. CCT Fire. Bring it home and upgrade today.
A pleasant good evening, one and all. We are off to another week of news here at 284 News, of course, coming to you live out of the beautiful British Virgin Islands. My name is Javon Wilson.
And I'm Ron Grant. I want to begin by just wishing you guys a happy Monday and also the utmost of safety. Before we get into our newscast, just reminding you, the British Virgin Islands welcome back cruise ship Grandeur of the seas this weekend, Saturday, July 17th, which is scheduled to be in the territory for some 6 weeks for a warm layup. Now, this information surrounding the vessel's visit to the territory was revealed in a media bulletin by the BVI Ports Authority, which confirmed that the ship is calling to the cruise pier from July 17th to the 22nd. Now, the ship will depart and return for layups on the 25th of July to the 19th of August and the 22nd of August to the 31st of August. Crew shore leave is not permitted, with the exception of crew airport exchanges only. The BVI Airports Authority is also reminding the public that the cruise pier area is a secured zone, that is, and persons are not permitted past the security gate.
All right, viewers, we're going to dive straight into our newscast for today. Now, the Ministry of Health and Social Development has confirmed 3 more COVID-related deaths, now bringing the total to 17 in the territory. This is according to an official release that was sent out by the government on Sunday, July 19th. The recently deceased are a 45-year-old male, a 49-year-old male, and a 39-year-old male who died at the Dr. D. Orlando Smith Hospital. Now, the Minister for Health and Social Development, Honorable Khadeen Malone, expressed condolences to the families and loved ones on behalf of the government of the Virgin Islands. Honorable Malone said, and I quote, "May God continue to comfort the many families and friends who are hurting and mourning the loss of their loved ones. We will spare no cost, no effort, or no time to get whatever we need to stabilize this condition and return to the Virgin Islands that we know, the Virgin Islands that we love." End of quote. Now, viewers, Honorable Malone also said that he is committed and continues to do all in his power, no matter what the challenges, to get the Virgin Islands safely out of this sphere. Now, the COVID hospital admissions summary statistics as of July 18th are as follows. We had 3 persons admitted to the ER with 4 deaths, 16 persons admitted to the COVID-19 ward with 8 deaths, 1 person admitted to the behavioral ward unit and remains in hospital, 4 persons admitted to the ICU, recording 4 deaths, and also 14 persons were discharged from the COVID-19 ward. We also had 1 person discharged from the obstetric unit and 24 hospital admitted patients, 1 of whom were vaccinated and 23 unvaccinated. Now, as of July 15th, active confirmed cases had fallen to 1,586 in the territory, with a reduction in active cases due to recoveries. Now, a significant amount of persons who actually succumbed to COVID-19 in the BVI had pre-existing chronic health conditions which exacerbated complications. This was revealed by Chief Medical Officer Dr. Ronald Georges during government's July 16th COVID-19 update. Dr. Ronald Georges said, and I quote, "When you look at the risk factors for mortality with regards to COVID, the international evidence is being borne right out here in the Virgin Islands. Most of our cases are obese, some morbidly obese, meaning very obese. Most of them have chronic diseases, are diabetic, hypertensive. A few of them had chronic lung conditions. Based on the international evidence, these are all at very high risk factors for mortality. And this is what is being borne out here in the Virgin Islands." End of quote. Now, viewers, the lead doctor is also concerned about the symptomatic persons who are reluctant to come forward and further implored persons to call the hotline or 911 before it is too late. He said, and I quote once again, "We have had many instances of persons who have been staying at home, not calling, and trying to look after themselves with various remedies, and it is not going well. We're asking you, please call for help. Do not stay at home in a dire condition. You can call 911 or 852-7650 to get assistance." Now, viewers, based on what we're following on international reports, we have seen a strong association between those underlying conditions mentioned before and the following outcomes: mortality, admission to hospital, or admission to the intensive care unit among those affected with COVID-19, older people, as we know, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness and possibly die from the virus. Dr. Georges stated that the vast majority of those persons who lost their lives to the virus were unvaccinated, and of course made an impassioned plea for persons to get inoculated soonest. He said, and I quote once again, "The evidence for the last 6 months worldwide has shown that over 99.5% of deaths worldwide have been unvaccinated. So despite everything we've been hearing, vaccination does prevent hospitalization, severe COVID, the need for ICU, and death in a large proportion of persons. So it is very important at this time to avail ourselves to the opportunity that exists for us to be vaccinated." We do know that the vaccination drive over the weekend was successful and continues throughout this week. But before we dive deeper into the newscast, Ron, I think it's just fitting for us at this number 17, such a significant number for our very small territory and very closely knitted community, for us to give a moment of silence to all of the persons who lost their lives to COVID-19. May their souls continue to rest in peace.
And speaking of viewers of the vaccination, a total sum of 887 persons received vaccinations over the weekend at Operation Protect Each Other Drive-Thru vaccination that took place on Saturday, July 17th and Sunday, July 18th, 2021 at the festival grounds. Now on Saturday, some 432 residents got vaccinated on the first day of the operation. Approximately 357 persons received their first dose, while 75 persons received their second dose, all of the AstraZeneca vaccine, to boost immunity to combat the COVID-19 virus. Now on Sunday, July 18th, 396 first doses were administered and some 59 second doses for a total of 455 vaccinations. Now the total vaccinations administered for both days is 887. The Operation Protect Each Other Drive-Thru vaccination will continue this week based on its recent success and heads to the Virgin Gorda area this weekend. Now the drive-thru will also, it allows vehicles to enter the eastern gate of the festival grounds and be able to register, get inoculated, receive their cards, and drive off in convenience of their cars. This comes as the British Virgin Islands, as we mentioned earlier, continues to report related deaths and hospitalizations. The Honorable Minister for Health and Social Development, the Honorable Khadeen Malone, stated that the initiative will give persons and the territory of the Virgin Islands a working chance in combating the virus. Honorable Malone also thanked His Excellency the Governor, John Ranking, and the supportive staff of the United Kingdom in providing the AstraZeneca vaccines on island. And of course, he announced that another shipment of vaccines and rapid tests will be arriving into the territory within this week. Now, persons age 18 and older are encouraged to pre-register, fill out forms available online at ministryofhealth.gov/vaccines, or register on site, walk with a government-issued identification, of course, wear your face mask, and wear short sleeve tops for easy access to getting their vaccine shot. The COVID-19 AstraZeneca vaccine provides viewers additional protection, preventing the reducing of the risk of severe illness, reducing the risk of death from COVID-19, and of course reducing the spread of COVID-19 and ultimately allowing the community to reconnect. COVID-19 vaccine paired with all health measures such as hand washing, sanitizing, proper face mask as well, and physical distancing can provide optimal protection as countries around the world are still adjusting to living with COVID-19. Jovan, we see where we have finally gotten to the stage where we're seeing persons a bit, I would say, desperate in their plea to have a solution. And I must admit, as a resident, it is a bit disheartening to see us have to get to this point. However, we are happy to see the government of the Virgin Islands continuously making strides to make it as accessible for persons to receive the vaccine who want to. I'm very happy that the drive-through was successful, and it continues, and also it continues to the sister islands.
Absolutely, and I know the Premier of the Virgin Islands did applaud Honorable Shari de Castro. I think this was actually her idea.
Yeah.
So very happy to see persons responding well. What we do see as you look at the numbers is persons were more so coming forward for that first shot.
Correct.
And I think, like you said, we came to a dire position in order to inspire persons to get the vaccines. But a lot of persons were inspired to come forward and get that first shot. Not so much the second dose. And of course, that beckons other questions. But we do know as well that just about 3,040 shots of the vaccines came in today by way of the British government, the United Kingdom, in their commitment to the BVI. So we have additional shots for persons who are still considering taking that first dose, which will also give them time to get that second dose before our stocks expire.
And also, of course, receiving from the UK rapid testing material, PCR testing. I think that's very important as well.
And so I think right now we have just about 48. If we're looking at a population estimated at 31,000, it would be just about 48% receiving their first dose, and just about 30% or a little over 30% on their second dose. One of the concerns as well, Ron, persons are really questioning whether AstraZeneca may be the best fit for them, and have continued to question why government isn't providing alternatives. For example, the Pfizer and Moderna.
Correct.
We're now hearing from the Minister of Health that will now be accessible via the USVI. Residents can actually travel to the USVI soon enough to get those shots. So we're going to get into that right after the commercial break. And also, Khadeen Palmer is the BVI's newest magistrate. We have all the details right after this commercial break.
Is business slow, cash flow down, hosting an upcoming event? We can help. Advertise with 284 Media and take your business or event to the next level by enhancing your present marketing and messaging strategies. Allow our team of experts to create a personalized ad that sets your business apart from all the rest. This could be your business or event. So, what are you waiting for? Contact our marketing team at 284media@cctbvi.com. Advertising with us works. Brilliant Hands and Minds Tutoring Services. One-on-one tutorials in math and English, intense homework assistance, academic enrichment, school projects, effective communication and public speaking development, sign language for adults and children on Saturdays only. Registered with the Virgin Islands High School Certificate Program, Brilliant Hands and Minds can help you too. Offering intense curriculum-based training to help you or your loved ones get their high school diploma. It's time to make your family's education a #1 priority. Hurry, space is limited. Brilliant Hands and Minds Learning Center. We are the trained education professionals.
Viewers, welcome back to 284 News. Now on we go with more local headlines. Residents of the BVI will soon be able to access the Moderna as well as Pfizer COVID-19 vaccines by way of travel to the United States Virgin Islands. This was confirmed by our newsroom in conversation with the Minister of Health and Social Development, Honorable Malone today, who said that the BVI is in conversation with the USVI to finalize an agreement that would facilitate the immunization initiative. Honorable Malone said, and I quote, "Official announcements will be made later this week for those who are intent on receiving only the Pfizer and Moderna vaccines. They will be advised on how to register here in the BVI and the USVI and how to, after traveling to the vaccination center in St. Thomas, be properly recorded in the BVI's registry." End of quote. The minister further revealed that BVI landers residing overseas who were also inoculated with the Moderna or Pfizer brands can also register their immunization with the new system. He said, and I quote once again, "Those vaccinated abroad are invited to register with the BVI registry so that proper data required will be recorded." End of quote. Now, viewers, some members of the BVI population have expressed concerns about the AstraZeneca vaccine on the premise that it actually offers a lower efficacy rate against the virus when compared to the other brands. As other vaccines, there have been some rare cases of side effects, resulting in local residents also petitioning the government to provide these alternative brands. Local health officials had initially expressed concerns about the storage of the Moderna and Pfizer vaccines, adding that it may be a challenge for the BVI. Now, as we know, the AstraZeneca shot is usually stored in a refrigerator between 2 to 8 degrees Celsius. Once removed from the fridge, it may be stored between 2 to 25 degrees Celsius for up to 6 hours, as you can see on the screen. The Moderna vaccine uses a similar innovative RNA technology to the Pfizer jab, but it is stored at temperatures of negative 20 degrees Celsius, like a normal freezer, compared to a negative 70 degrees Celsius for the Pfizer vaccine. It also can be stored for 30 days at normal fridge temperatures. As we know, residents continue to question why local government isn't pursuing the equipment that is necessary to facilitate storage of other COVID-19 brands as seen in the U.S. Virgin Islands. They have also shared concerns about the exponential cost associated with having to now travel to the USVI to secure COVID-19 shots. According to recent updates in the territory, an estimated 15,000 persons have now received their first shot, and we also have just about 10,500 receiving their final dose of the AstraZeneca vaccine. Well, as we continue to examine the numbers, I know one of the questions that continues to surface is the possibility whether we'll have other brands. I mean, it's
Correct.
not just for Moderna and Pfizer. There are several other brands of vaccines that have been proven effective against the virus. And what we do know is the AstraZeneca may have one of the lowest efficacies. We're not knocking it. Yes, we are grateful for the vaccine and being able to access it by way of the UK's commitment to the BVI. However, as the Delta variant makes its way into the region and possibly in the BVI as we await confirmations, we are certainly nervous about the fact that it may not be able to fully protect us against new variants.
Jovan, I'm going to go out on a limb here and give you my personal opinion. I think the government of the Virgin Islands did what they thought was best. The AstraZeneca vaccine is what was presented to the British Virgin Islands by way of the UK, which is exactly the same with another of our brothers and sisters. At this point in the game, so late in the game, for persons to beckon and to call for additional options, I think is somewhat unwarranted. And I think if that was the case, then persons within the Virgin Islands who did know that they wanted to seriously take the vaccine but wanted another option should have figured that out on their own after understanding that this is what we were given. I don't think at this point in the game, while I applaud the government for making those allocations to trying to make a provision for the other vaccines. At this point, I think if it was of that serious concern for you as a resident, then you should make other concerns. I don't think it's fair. We were given what we were given, and we have to work with that.
Absolutely, and I do agree with that to a certain extent. But persons have expressed opinions about wanting a different brand simply because when you examine also the fallouts from these vaccines, the effects, persons are affected in very different ways.
Correct.
So I guess people really want to know that they have the options. And also, one resident said that the BVI government actually was able to secure these vaccines for free by way of the UK government. So what about investing some amount of monies into other brands that will make people, maybe it may be one of the deterrents why we're seeing such low numbers in getting vaccinated. And we don't know for sure if that's going to change with these options now being made available. But I think I am happy to see the government providing
Making
as many
strides,
options.
absolutely.
Because one of the things we cannot say is that the government did not try to make the vaccines accessible to the people.
I agree with you. And speaking of deterrence, I must comment on one of the major deterrents that I've been hearing, and of course you and I know within the discussion it's not a for or against, it's a personal choice. But from the utmost, we've been hearing about preconceived or pre-existing conditions that could vary from anything. And I think that we perhaps we did not really educate our general public in the best sense that we could have. Persons literally took pre-existing conditions to mean anything. Okay, and what they fail to realize and it's only in speaking to the experts that you could really understand that as someone who may have any level of pre-existing conditions, that is perhaps the single most important reasons that you should take the vaccine. But I don't think that messaging was really articulated from the very beginning. It was clear. It wasn't clear, and it was left for the general public to just determine that if I butt my toe, then perhaps that means I have a pre-existing condition.
Right.
And I don't think that we really gave ourselves a fighting chance when it came to that argument. So we want to encourage persons. Again, it's a personal decision, but weigh your pros and cons, but please consider and consult the experts.
All right, and we know the public has so many questions that are left unanswered, and of course we're trying to get those questions answered. Tomorrow we are expecting the Minister of Health in studio for an exclusive interview. Alongside him will be Dr. Ronald Georges. So viewers, if you have questions that require answers, feel free to send those to our inbox as they may be asked.
Now on to some very positive and exciting news. Miss Khadeen Palmer is the British Virgin Islands' newest magistrate for taking the oath of office, which was administered by the Governor, His Excellency John Ranking, on Thursday, July 15th. This is according to a media release from the Office of the Governor, which said that Palmer pledged to faithfully carry out her duties during a privately held ceremony at the Governor's office. Now, the new magistrate's appointment is in accordance with Section 95 of the Virgin Islands Constitution and in consultation with the Judicial and Legal Services Commission. Governor Ranking encouraged Palmer to do her part to further the rule of law. He said, and I quote, "I offer every best wish as you join the BVI's magistracy, and I am confident that your professional expertise and experience will serve the court well as you hear cases and issue judgments. As governor, I will continue to do all I can to support you, the magistracy, in line with our collective goal of a fair and just society that adheres to the rule of law." Now, let's go into detail a bit, viewers, about the role and qualifications of the magistrate. Of course, the magistrate will hear and pass rulings in all civil, criminal, and quintessential criminal matters filed at the magistrate's court and help manage the operations of the court in its efficient and competent manner to ensure a professional and fair judicial system. Now, Palmer has served as a resident magistrate with the magistracy in Belize since 2018. Her professional experience includes service as Assistant Registrar General of Belize Supreme Court, Deputy Registrar General for Births, Deaths, and Marriages with Belize Attorney General Ministry, and a private practice legal associate. Palmer holds a certificate of legal education from the Norman Manley Law School, a certificate of public international law from the Higgu Academy of International Law, as well as a bachelor's degree in law and psychology from the University of the West Indies. Beautiful news, Jovan. Of course, we have a young professional coming to the magistracy, and we are happy to have her, and we welcome her to the beautiful British Virgin Islands.
Absolutely. Wish her all the best. Now, viewers, still ahead of the break, USVI hospitalizations, surged to 15 as they too suspect that the Delta variant is in the territory. We have all the details, as well as Soca Star BDJ being arrested for alleged rape. All that and so much more right after this commercial break.
The win.
What if the
I'm freaking out.
gender is about these people?
It's always a pleasure coming to you live and direct from the
What's poppin'? What's really good?
Davis has won it for the Lakers.
So you're saying I can ask this cat any question?
The cat is connected to the computer. You just type in the question, it will read his mind. There the answer comes.
You're the man! I've been looking for this for weeks.
Viewers, welcome back. Thank you for your time. Health officials over in the U.S. Virgin Islands are ramping up their calls to the public to get vaccinated, as the highly transmittable and deadly Delta COVID-19 variant, which the British Virgin Islands health officials believe is responsible for our very dire situations here in the BVI, is also suspected in the USVI Virgin Islands, with concrete proof coming from sometime this week. Now, as of Sunday, the territory of the USVI had 15 COVID patients hospitalized, 10 on St. Thomas and 5 on St. Croix, according to data provided to the consortium, of course, by the Health Commissioner, Justa Inarco. Now, of the 15 people hospitalized, 3 were on ventilators, 2 on St. Thomas and 1 on St. Croix, the Health Commissioner made known. Now, the officials also said that there would have been more deaths and hospitalizations if the territory had not been utilizing the antibody treatments on patients, which has been proven to help severely ill COVID-19 patients. Now, the Schneider Regional Medical Center had administered 203 MAB treatments to date, while the Juan F. Louis Hospital has administered 43, according to Health Commissioner. Jovan, we see where the situation, we recently just heard from Governor Albert Bryan, and now we see where the situation in St. Thomas and St. Croix as well is continuing to rise.
Yes, and they made mention of the antibody treatments. I do know that the Minister of Health here in the Virgin Islands, Honorable Carvin Malone, did mention the possibility of the USVI being able to support us
yes,
with some of that antibody treatments, because we have been trying to figure out here at 284 Media what treatment is being given to the COVID-19 patients as they're admitted to the ICU as well as the ER, the COVID ward here in the Virgin Islands. Not sure as yet, but the minister did say that they're trying their utmost best as of this morning, that is, to get that antibody treatment here into the territory. Now, more news in the USVI. A popular St. Thomas soca artist has now been arrested for allegedly sexually assaulting a minor on several occasions. This is according to the VIPD Public Information Officer, Toby DeRima. Now, the suspect is also charged with aggravated rape. Now, according to the VIPD news release, Jefferson Foston, also known as BDJ, I know many of you know him within these Virgin Islands, who has worked with multiple bands, including one at the point, the Venomous Poison Band, but most recently has been pursuing a solo career, turned himself into police on Saturday night at 9:48 p.m. after learning that he was wanted by the police. Now, Foston, 31 years old, was placed under arrest and charged with aggravated rape, child abuse, and unlawful sexual conduct for allegedly sexually assaulting the minor female on several occasions. Now, unable to make a bail of $75,000, Foston was remanded to the Bureau of Corrections pending his advisement hearing, Mr. DeRima said. Now, viewers, detectives are now urging anyone with information regarding the alleged crime to call 911 in the USVI, the Criminal Investigation Bureau, at the numbers provided, or anonymously. You can call through the Crime Stoppers hotline at 222-TIPS. Now, very strange situation in the U.S. Virgin Islands, Ron.
Yes.
Very well-known soca artist, slapped with quite a number of charges as it relates to sexual assault against a minor. I think what these cases continue to prove to us is that, again, nobody is above the law. And whenever persons of any stature are convicted or charged for serious offenses like these, we really have to set a precedence out of the situation to ensure that, you know, situations like this does not continue to happen.
I could not agree with you more, Jovan. Before we go, I want to remind persons, the general public, or rather, that the drive-through vaccination for those who are interested continues this week.
Yes.
Due to the success of it, the Ministry of Health and Social Development, they're continuing the operations at the festival grounds. It's going on today. It has gone on today, and it continues this week. So we encourage you, if you like, to go out and be vaccinated. Viewers, that's all the time we have. It's the beginning of a beautiful week. We're thankful to be here and to be thankful to be giving you the daily dose of local, regional, and international content. I'm Ron Grant.
And my name is Javon Wilson. Again, reminding you to check out our website. I mean, we do 30 minutes here, but there's so much more available via our website daily. That is 284media.com. We're also on Facebook at 284media and Twitter and Instagram at 284BVI. My name is Javon Wilson. Thank you so much for joining us.
Bye-bye.